we'll show you a patient today who is a post-op removal of a posterior heel spur. And she had spurring on the back of superior portion of her heel, proximal, and also spurring in the tendon itself. So what we're able to do is use a minimally invasive technique, which we have developed, where we go on the side and go underneath the tendon and take the, this is the incision we do that through. These are percutaneous incisions, and we basically take the proximal superior portion off of the calcaneus, and that way this tendon is not pinching the calcaneus. And then we go superficial to the tendon with another incision, and this allows us to remove the spur portion. Now in some patients, if the spur is big, you don't have to take the whole spur out. You can actually just detach the spur from the heel. In her particular case, we're able to get the entire heel spur out, including the spurring in the tendon. It's just the way her natting was presented, and we were able to do that. So what's amazing about this compared to what we used to do, now I still do this some in certain patients. We used to take the tendon off the heel, take the spur out, and tack the tendon back on. The problem with that surgery works extremely well. Matter of fact, I would say it's close to about 100% as you can get with most surgeries. However, the recovery is extensive. This patient is only 4 weeks after we took the bone spur off the back of her heel. This is what she's wearing right now. So she's not even in a surgical shoe. She's able to wear regular shoes at 4 weeks and walk normal. Now, Angela, before the surgery that we did on you, from 0 to 10, what was your pain every day?
Probably a 6 or 7, and it would spike up. I mean, like, take my breath away.
The spiking up, would you consider that a 10 or what?
Well, I consider that about a 12.
Okay. So you did have times in which it was up pretty high.
Oh, yes.
Okay, so now only 4 weeks after the surgery, and you're walking around, you're kind of doing your kind of normal activity. Yeah. What is your pain now at 4 weeks?
It's probably about 2 or 3. A Tylenol will take care of it, but it's just enough to remind me not to overdo.
But so you're already down to a 2 or 3 already. Now, when I move you through the range of motion, is any of that hurting at all?
No.
You don't feel anything?
It's just tight a little bit, but I've tried to exercise it that way and curl my toes and stretch and do those things.
Now, one of the things we're asked sometimes is, what about the tight tendon? Well, in some patients, they have most all patients do have gastric equinus, and we actually lengthen tendon. She didn't have that. She just had the spurring in the back, or she doesn't have gastric equinus. So we're able to, which is kind of unusual because most people do, but so we're able to do hers totally minimally invasive just with the spur. And we're hoping she gets better and better and better. Right now we're on a really good track with it.
Yes, indeed.
We'll follow her all the way out and see how, and show you how she does. And so far we've done around 20 procedures on both sides within a certain period of time. And we're going to compare those procedures and how they do. And that would be the open procedure compared to the percutaneous. To give you an idea of that and what we're finding, I did a patient the same day that we did her, we did it open. And so that's 4 weeks ago. She still is on crutches and wearing a cast. So there's a big difference between the two surgeries in terms of the patient's recovery and how the patients perceive the surgery and everything like that. I appreciate it. Thank you.
Thank you.